You have knee or shoulder pain and you've been wondering if there might be options for treatment to give you some pain relief that doesn't involve surgery. Tonight, we're going to be educated by Dr. Kelly Cunningham. He's a board certified orthopedic surgeon in Austin, and we're going to be learning all about the different types of therapy. So, Dr. Cunningham, let's start with we've heard the term biologics, perhaps, and maybe been a little confused of what that actually means. Let's start with what that means.
Sure, Kim, and thanks for moderating. I hope people will find this helpful. So, I'm an orthopedic surgeon, but a few years ago I began delving pretty deeply after some study abroad, uh, 20 plus years into my practice, into a field called orthobiologics. And orthobiologics is taking some of the natural substances from your own body, such as stem cells, or better known as cell therapy, and platelet-rich plasma, PRP, and using those to treat bone and joint conditions, early arthritis, sports injuries, instead of or in conjunction with surgery. So what you see here is a good schematic representation of one of the two different modalities that I've begun to use much more frequently over the last 7 to 8 years. These are cellular based treatments from bone marrow or from fat cells. I
Mhm.
primarily use stem cell based therapy from bone marrow. And what we find that these treat are the pain levels and increased activity desires of my older athletes. We often refer to my business now as mature sports medicine. And we find that as we age, we have different aches and pains than we did
Mhm.
in our 20s and 30s for
Mhm.
sure. So, stem cell is the one that I use for the more severe, moderate to severe arthritis, primarily of the knee, the shoulder,
Mhm.
the hip, elbow, and ankle. I don't really do this with spine and neck, although it is done by other practitioners in other
Mhm.
locations.
Mhm.
And then the second orthobiologic that we frequently use these days, and mostly in an office setting, is called platelet-rich plasma. That's a mouthful, so we shorten it to PRP. This is a very, very up-and-coming treatment that's been used in Europe for decades, actually, and has become quite popular in the athletic world here. This is a schematic representation. You'll see that the plasma color, all of the red cells have been removed by treatment and centrifugation in our office, and we're using actually in the doctor's right hand there an ultrasound to guide the injection of the knee. Again, often an injection involving the knee, the shoulder, or the hip.
And these are ways to be able to sort of, I mean, really just use what's already in your body.
Exactly. So they're not completely risk free, but they're certainly less risky than some of the other treatments, such as steroid injections, obviously surgery. They
Mhm.
can be used in conjunction with surgery, and we'll talk about that a little bit later, Kim.
Mhm.
But now I find that the vast majority of patients come in looking for alternatives to either avoid or at least delay surgery and
Mhm.
often joint replacement. And we found a very willing crowd here in Austin, Texas, of people
Mhm.
who are anxious to try these modalities, and we'll be showing some of the
Mhm.
success rates over
Mhm.
different time periods here later in this discussion.
And going back to kind of the joints that you typically focus on are going to be starting with the shoulder. What kinds of issues do people typically have?
So, in the shoulder, what we often see as we get older, let's say mid 50s and up, rotator cuff tear is far and away the most common. Uh, and we also see labral cartilage tears. What we see more and more because of the increased activity of this generation of aging athletes is also arthritis of the shoulder. And we try to catch these arthritic and rotator cuff problems early in the course so that indeed we can avoid surgery, and if not, use PRP or stem cell as an adjunct to surgery to improve healing rates, and most importantly in the shoulder, to decrease reoperation
Mhm.
rates. There's
And then
lots of literature that has shown that is a solid modality
Mhm.
for orthobiologics.
And what are generally the outcomes that you're looking for with PRP and stem cell?
Well, let's go to a couple of statistical slides, and hopefully these will transmit well enough. So this is a company called Data Biologics, a really value-added company through the pain management and orthopedic world, has been tabulating across a number of clinics in North America for several years. And this chart will compare all of the clinics that are in the Data Biologics world to ours. So if you look at the black line out through 12 months, which is approximately 14,000 patients, believe it or not, and it's growing weekly, versus the purple line below it is the Austin OrthoBiologics, which is about approximately 300 patients. And we picked up on this about 18 months ago. So our endpoint is a little bit shorter. It's at 12 months. But this is a numeric pain rating, 1 to 10. Most patients started somewhere in the 5 to 6 range, which you'll see there. And we feel that the Data Biologics numbers from a large series is quite good. The pain is down below 3 at 12 months, and we anticipate that will, because this is a combination of both PRP and the stem cell, will continue through 18 months. But look at the purple line. Lower is better. The less pain you have, the lower the line will be. So starting at about 3 and continuing through 6 to 12 months, we actually feel like our patients all across the board. And when you look over to the right, you'll see that the majority are knees, but there's a lot of hips and shoulders as well.
Hmm.
Those patients have less pain than even the baseline pain relief that the clinics around the country are seeing. So we feel this really merits consideration.
Hmm.
This is a procedure that works for the vast majority of people in terms of relieving their pain.
Yeah. Okay. Great. Now let's look specifically at the shoulder results that you've seen, so that we can kind of talk about the shoulder effectiveness.
So this is more of an activity rating. This is called the Quick Dash method, and Quick Dash is just an algorithm. Lower is better. The less restriction you have in terms of return to activity at 6, 9, and 12 months, even out to 24 months for the larger series, which again is in this case for shoulders is close to 3,000 patients.
Hmm.
The black line is mirrored quite closely by our purple line, which is approximately 75 patients. We've done many more than that, but these are the ones that have responded to the patient-reported outcomes, PRO, questionnaires that we send out on a several-month basis.
Hmm.
Average age 58, average injections a little over 1. So
Hmm.
most of these patients don't even need a second injection within 12 to 18 months. We would anticipate that we will mirror the curve of the black line as we
Hmm.
follow our patients further out. But once again, this is a little bit closer, but we feel like we're actually exceeding the improvement of the large group. So we're
Hmm.
quite happy with the treatment using both PRP and stem cell of the shoulder.